My name is D Winthrop. I live in Lansing, Michigan. I lived here pretty near 40 years. I also live in California. I have a second home out there. And when I'm in California, I'm a legal medical cannabis user. When I'm here in Michigan, of course, I'm an outlaw. That's going to change very shortly, April 4th or thereabouts. But for the moment, I'm still an outlaw. 33 years ago, I guess it would have been, Bob Randall, who was patient one, the first medical cannabis patient in this country, first legal medical cannabis patient, invited me to join a nascent crusade for the rights of medical cannabis patients with the words that I don't wish to be the only man in the lifeboat. Bob, you see, had been busted for cannabis in Washington, D.C., federal court, raised an affirmative defense of medical necessity, prevailed. Went on to force the federal government to supply him with NIDA-issued federal cigarettes, 2 or 3% of what looked like green pell-mells and were essentially garbage pot. And he would smoke 20 or 40 of those a day and prevent glaucoma from claiming his sight. Bob went into the test tube, so to speak, at Johns Hopkins, at the University of North Carolina, and at UCLA on 3 different occasions, when the federals had basically taken away his cannabis. Each time he was measured, benchmarked, each time he lost sight, he was willing to do that, you know, to not self-medicate, but to do without his only medication, the only thing that stood between him and blindness, in order to prove the point that it was cannabis that was saving his sight. And for the next 25 odd years, until he died in 2001 of HIV. Bob and his partner Alice O'Leary did little else with their lives but devote themselves to the building of a medical cannabis movement. Today, we have the fruits of that movement. In its first form, it resulted in some 35 or 36 states passing IND-based legislation to seek federal cannabis from the government. Only a handful of those states ever received any cannabis, Michigan being one of them, because we play hardball in Michigan. Other people play tiddlywinks. What we had done in Michigan is we had anticipated federal resistance. And we had filed a series of Freedom of Information Acts on the Research Institute of Pharmaceutical Sciences in Oxford, Mississippi, which is a NIDA contractor sole supplier for all of the legal cannabis used for research and medical purpose in the United States, at least at the time. We had filed these FOIAs on them and on the Drug Enforcement Administration to see what they were saying about us, and on the Food and Drug Administration because we had to get their approval for our investigational new drug application here in Michigan, which we did. What we discovered was that NIDA had more cannabis than they told us. They had more of slightly higher quality than they told us they had. They had some around 3%, and we wanted at least 2%. We were arguing over 2% cannabis. And what they sent us for our cancer patients, our very first batch of cannabis in 1980 from NIDA, direct from DC, was 0.18%. It was 5 years old. It had been mildewed. It had been steam cleaned. I kid you not, it had been steam cleaned. It had been put back in the closet for 3 years, kept in a non-temperature controlled environment, in which cannabis will degrade, THC will degrade at about 7% per month at room temperature. So you can do the math yourself. This was worthless cannabis. Not only was it worthless, it was probably dangerous because it was so harsh and dry and worthless. But nevertheless, we gave it to our cancer patients who almost uniformly rejected it. We got our FOI in about the same time, and we discovered that the cannabis that they had sent us, which we could identify by a particular batch number, we quite literally could tell you the day it was put in the ground, where the seed came from. Couldn't tell you who put it there, but we knew the whole history of this batch and its preparation from the time it went in the ground to the time it came to Michigan patients. And we had a memo from NIDA that said, this batch is, quote, unfit for therapeutic use, dated 7 days before they sent it to Michigan to give to our cancer patients. So what do you think we did with that? We did what any good citizen would do. We went to the newspapers. We told the free press. And the federal government got splashed in the free press. Steve Monsma, Carl Levin, a lot of people stood up and said they're trying to sabotage us, which of course they were. That was on a Saturday. On Monday morning up at Public Health, we had brand new federal cigarettes, 2% THC, sent by Federal Express, illegally I should add. And they never bothered us again. They went down to Georgia and they stomped Georgia into the mud. Georgia never got any federal cannabis for their medical cannabis program, which followed us. We got ours. We ran for 3 years. We served hundreds of patients here successfully. We had no adverse side effects more serious than a cottonmouth. And through bureaucratic indifference, overregulation, federal intransigence, and a general I don't give a damn attitude on the part of the medical profession and many public officials, the law sunsetted very quietly in the middle of the 80s and went away. And for the last 20 years, 30 years for that matter, we have been faced by a wall of indifference, a wall of fear, a wall of ignorance. Public policy officials would let people suffer and die rather than face their own fears and their own ignorance and deal with a difficult public issue. The history of medical cannabis in America is a history of public policy failure by our elected officials, by our public servants. With very few exceptions, they have failed us all, and the pain and the suffering and even the death that they have caused lies at their feet and remains on their hands. We, however, of the Michigan Medical Marijuana Association and the community it represents, which is the entire medical cannabis industry, everybody, will not allow failure to happen again. We have a simple mission. We are here to assure a safe, effective, and cost-efficient supply of legal, medical quality cannabis reaches every patient in Michigan who has a qualifying physician endorsement. Everybody. If you're turned down by the state, we'll sue. And we will win because our research, our support, our people, our medical staff, our chemists, our growers, our breeders, our cultivators know more about cannabis than anybody in the state of Michigan. We know what we're doing. We've been doing it for 30 years. We've been helping people for 30 years. We have improved the stock of cannabis to the point that 2% or 3% THC isn't even considered medical quality. In California, I routinely purchase 15, 20, 25, even 30% THC cannabis from any number of local distributors who are growing or using locally grown and supplied products. None of this stuff is coming in from abroad. It's not even coming in from Northern California. It's coming in from the mountain ranges north of Los Angeles and Santa Barbara. Almost all of it is indoors, and almost all of it is extremely high quality. If we want high quality cannabis here in Michigan, we're going to have to work for it. What we did on November 4th was we seized control of our own futures and our own lives. Vox Populi, the people have spoken. 3,006,820 Michiganders voted for medical cannabis. Less than 3 million people, Michiganders, voted for Barack Obama. Medical cannabis is the top vote getter to ever appear on a Michigan ballot. Man or issue or anything. Nobody, nothing, has pulled 3 million votes in Michigan except medical cannabis. And what that means to us is that we're no longer the lunatic fringe. We're no longer marginalized. We're no longer peace and love hippies. We're no longer sitting on the couch with our bongs watching Nickelodeon for 30 years. Actually, we've been out there working and preparing for this day. The day has now come. We have just come back from a Rules Commission hearing downtown Lansing, where we see that we have some issues with the state. They don't seem to understand the cultivation industry. They don't really understand medical cannabis. But they're nevertheless willing to draw rules that circumscribe the campaigns of our lives, that will dictate the quality of our lives without even beginning to understand what it is they're trying to regulate. Did they talk to us? No. Did they talk to growers or cultivators? Of course not. I've spent the last 3 months in California on behalf the M3A. I have been working with growers and dispensaries and cultivators and ASA chapters and lawyers and anybody else to see what California has that they can offer to us here in Michigan. And it's a great deal. They have a working system in California. They have a system there that provides for the needs of its patients. I can attest to this personally. I no longer have to crawl up my stairs, which quite literally I was doing a year ago. We have here in Michigan already the people, the resources. We have the skills, and we have the will to fulfill our mission. We are going to bring safe, effective, cost-efficient medical cannabis to everybody who needs it. And if the state stands in the way, we'll see them in the legislature, we'll see them in the courts, maybe we'll see them in the ballot box again. I told the regulator, one of the regulators this morning, that if they turn down conditions, we will appeal any condition. If you come in with a physician's letter, we will support you. We will get you your cannabis. I also told her that the next time we go to the polls, it won't be 3 million votes. It'll be 4 million. And it won't be just for medical cannabis. It'll be for the whole ball of wax.